Good afternoon. My name is Julie Murphy. I'm Flagler County Public Information Officer. Thank you for joining our Facebook Live. I just want to note we're practicing good social distancing. Everybody will leave to the my right, your left. We all have our own microphone, which you can tell by the tape color on the bottom. And I'm now going to introduce our Emergency Management Director, Jonathan Lord.
Thank you, Julie. Good afternoon. COVID-19 cases continue to rapidly increase in our community and state. Last night, the governor's Stay Safer at Home executive order went into effect. This order states that senior citizens and individuals with significant underlying medical conditions shall stay at home and take all measures to limit the risk of exposure to COVID-19. Additionally, this order states that all persons in Florida shall limit their movements and personal interactions outside of their home to only those necessary to obtain or provide essential services or conduct essential activities. While there's a list of essential services and activities that are exempt from this order, everyone should be focusing on the intent of the order, which is that it is safer at home. That is the only way to protect yourself, your household, and our entire community. Failure to follow this order may impact the life of someone else in our community. For those of you participating in essential activities or services, you must continue to follow CDC guidance that includes social distancing measures, such as staying at least 6 feet away from others, even when you are shopping and standing in the checkout line, and remaining in groups of less than 10. It is everyone's responsibility to practice proper hygiene, to include hand washing and frequent cleaning.
And I just want to note that someone on Facebook noted we have the same microphone. We do not. Everybody has their own individual microphone.
If you believe you may have COVID-19 symptoms, to include fever, cough, and shortness of breath, please contact your healthcare provider directly. If you do not have a regular healthcare provider, you may contact an urgent care center or Florida Health for guidance and possible testing. There are also less restrictive regional drive-up testing sites available in Jacksonville and Orlando. Please remember that every one of us can make a difference if we abide by the Safer at Home order and follow CDC guidance. We remain acutely aware of the employment and economic impacts COVID-19 is having on our community. Our economic development team is working together to share available resources. We continue to encourage residents and businesses to use the Flagler Open for Biz website. In support of the order and CDC guidance, Flagler County has shifted our Board of County Commission meetings to a virtual platform, starting with Monday, April 6th meeting, which starts at 9 a.m. We encourage the public to participate through any of the following options: watching the meeting on Spectrum Cable Channel 492, watching the meeting via YouTube, which you can find by going to www.flaglercounty.org and selecting the YouTube icon. You may also view the meeting via Zoom by going to zoom.us/J/283845854. Or you can listen into the meeting by calling 312-626-6799 or 929-205-6099 and entering the webinar ID 283-845-854 and then following the voice prompts. Additionally, those who would like to make public comments during that meeting can either email publiccomments@flaglercounty.org before and during the meeting. Those comments will be read at the meeting and there is a 450 word limit. The other option you have is by calling 386-313-4001 before or during the meeting to provide comments of up to 3 minutes. For additional public health information on COVID-19, to include the latest testing guidance, please call the Florida Health Hotline at 866-779-6121. For information specific to local government services, please contact the Flagler County Emergency Operations Center at 386-313-4200. Or even better, visit our website at www.flaglercounty.org and follow the links for COVID-19. For our latest updates, please follow Flagler EOC, which is one word, on Facebook, Twitter, and Instagram. Thank you all for being part of the solution.
I would now like to introduce our Florida Public Health Director in Flagler County, Bob Snyder.
Good afternoon. First, I'd like to share current data on cases from the state of Florida and Flagler County. This information is accurate and it's produced by the State Department of Health in Tallahassee. The number of positive cases comes directly from the state public health, hospital, and commercial labs and automatically populates the statewide surveillance database. There's about 200 labs across the state of Florida that are now doing testing, which is quite an increase from just 2 weeks ago. As of noon today, total positive cases in Florida is 9,585. Kind of put it into perspective, just 2 weeks ago, the total cases in Florida was 42, and now it's 9,585 positive cases. Total hospitalized statewide is 1,215, and total deaths is 163. The mortality rate in Florida is 1.5%. In Florida, 86,385 individual test results have been received by the Department of Health. So a lot of testing is going on in the state. At this time, the state has an adequate number of ICU beds, and this is the case locally at Advent Health Palm Coast. In Flagler County, we have 27 total positive cases, including 1 non-county resident and 4 hospitalizations. Total persons under investigation in the county is 290. Of that number, 27 tested positive. And those are the positive cases that I just mentioned, and the rest tested negative, for a positive percentage rate of 10%, which is equal to the state average of 10%. So what I just shared is available to the public, and that this information is updated twice a day at noontime and at 6 p.m. So please go to www.floridahealth.gov. This is the one valid source of data in the state, along with the CDC website. It's where all the numbers are calculated and tabulated.
We have a question. Do the total cases include those recovered?
No, it does not. And we are suggesting here locally, a few counties have put in a request to Tallahassee that we truly need to start capturing that information. I think that's good information to have. So please hold tight. We put in a request for that so that that is shared statewide through the website that I just mentioned. But you can get total cases, the number of positive and negative tests, results by city and county, and just so much more information on that website. So Flagler County, our goal still remains the same: to stifle the virus spread from person to person. There are 2 realistic paths to achieve this population level immunity. One path is the vaccine, which experts say is a year or more away. The other path is for the disease to work its way through the population, and for those who are positive for COVID-19 to recover and become immune. A Teflon status, so to speak. I'm sure that most of you viewed the White House press conference this past Tuesday, in which the president and his public health advisors shared some sobering news regarding the new modeling forecasts about deaths that nationally could range from 100,000 to 240,000 Americans. Different parts of the country and states have managed the response differently. Florida has focused on containment and mitigation efforts. Our outcomes could be different if we stick to the plan and adhere to the many executive orders initiated by the governor, Flagler County, and the city of Palm Coast. Locally, what comes to mind is Palm Coast stay at home, stay safe emergency proclamation, and the county and the city of Flagler Beach's order to close the beaches. With no vaccine nor an antiviral medication, these containment and mitigation strategies need to be embraced like never before. If you have the clinical symptoms of fever, cough, and shortness of breath, self-isolate and call your healthcare provider or health department. Stay home, stay put, and avoid others. Practice rigorous hand washing. Smother your cough and sneeze. Use generous amounts of hand sanitizers. Work remotely from home if you can. Support local businesses through the takeout and home delivery services while practicing social distancing. And disinfect surfaces, especially those that are frequently touched. And please try not to touch your face. I know that's hard. So let's talk about testing, the other tool in our arsenal. In Flagler County, there are a limited number of sites that conduct diagnostic testing for individuals that meet testing criteria. And yes, just a word about testing criteria. We've all heard about the national shortage and statewide shortage of testing equipment, whether it's testing reagents that's used in the labs or test collection kits or personal protective equipment like the gowns and the masks and the gloves that are used by staff, our staff and hospital staff, to do the testing and collect the specimen. So that's why testing criteria is just so important. We're hampered by this national shortage, but it's been acknowledged and it's being addressed quickly by federal and state government. In private industry, they're all focused on addressing this dilemma, but we still have to use and apply testing criteria. So just this week, the health department received a shipment of 100 test collection kits, and again, the supplies are trickling in daily across the state of Florida. So those with the clinical symptoms that I just mentioned of fever, cough, and shortness of breath who are hospitalized in a nursing home or a long-term care facility, healthcare workers, first responders, people over the age of 65 who possess underlying conditions like congestive heart failure, COPD, lung and heart disease, and cancer, and those who are immunocompromised. These are the individuals, along with the clinical symptoms, who meet the testing criteria and should be tested. And also individuals who are exposed to someone who did test positive for the virus already. Yes, Julie?
So someone is asking on Facebook if you can come up with a reason why somebody who would seem to meet the criteria would be turned away from testing.
Well, the main reason for that is, like I just mentioned, there is a shortage of testing equipment, the PPE devices, the gowns, the masks, the gloves. There is a shortage, and so that's why we have to apply the testing criteria. With the strict advice of, isolating yourself at home if you have the symptoms and possibly have been exposed to a positive case and you're concerned that you might have the symptoms, the first thing you do is self-isolate, call your primary care physician, or the health department or an urgent care center to see if you meet the criteria for testing. We yearn for the day, and hopefully it'll come soon, where surveillance testing will take over, where, people broadly in our communities across the state will be able to take advantage of what we call point of care testing, similar to the flu test that you would get from your doctor's office. Remember, they can give you the test results like within 15 minutes. It's a rapid testing unit, a rapid testing device. Abbott Labs is producing that right now, and it's being used in parts of the state of New York. And Governor DeSantis has asked that Abbott Labs send these point of care testing kits, rapid testing kits, down to South Florida, where that's the most hardest hit part of our state. So right now, diagnostic testing is what we're able to do. And the testing criteria has changed twice now. Just 2.5, 3 weeks ago, the testing criteria was clinical symptoms and you traveled to one of the level 2 or level 3 countries where the outbreaks have been the greatest, or you had the clinical symptoms and you were exposed or came into close contact with an already established infected person. So maybe about a week and a half ago is when the criteria expanded, less restrictive, to include over the age of 65, people who are immunocompromised, people who are over the age of 65 and have underlying conditions, people who are hospitalized, those in nursing homes that we're possibly concerned about. So the testing criteria is broadening and it is less restrictive. And we expect that to change as time goes on here, so that more people can meet the testing criteria. So it's all hands on deck at your county health department. Our dedicated and focused team are donning the proper PPE attire, and we're testing throughout the day. We collect and package the specimens for transport to the state lab in Jacksonville. We monitor the positive cases who are in self-isolation for 14 days. We monitor the persons under investigation, and we do a very, very important epidemiological task that is critical right now, and is called contact tracing, where we connect with the close contacts of an infected person. We screen them, and we identify individuals that have prolonged contact with positive cases during that previous 14 days. But the key word here is prolonged, which is exposure within a 6-foot distance of an infected person for greater than 30 minutes. Examples of a close contact might be a spouse, someone you're having intimate relations with, an immediate family member, or let's say an in-home caregiver. Also, the close contact reference includes people who cough or sneeze and don't cover their nose or mouth, and the droplets could spray in your direction. Not cool. So please, please do your best impression of Dracula when you must. When you're about to cough or sneeze, don't sneeze or cough into your hand. Sneeze or cough into your arm at all times. Now, a word about antiviral medications that are on trial, clinical trial in New York, specifically hydroxychloroquine in combination with the Z-Pak that we're familiar with. Governor DeSantis has asked that this combination of medications become available to the hard-hit counties and health systems in South Florida. We're getting many questions about wearing masks, so I'd like to take that topic up for a second here. On Tuesday, Dr. Fauci shared with the nation that the White House Coronavirus Task Force is very actively discussing with the CDC the idea of recommending broad use of masks. Part of the issue, again, is that supply of masks today would not meet the demand. But two things we know for sure. Positive and presumptive persons with clinical symptoms should be wearing a mask. Also, healthcare workers who are in constant contact with patients should be protected. If you are fortunate enough to have a mask, wear it. If you don't have a mask, you can use a scarf or a bandana. Lastly, the crisis has been compared to fighting a war against an invisible enemy. The foot soldiers on the front lines working tirelessly to save lives are your public servants at the health department, hospital, nursing homes, long-term care facilities, EMS and fire rescue, law enforcement, city and county employees, Jonathan Lord and his crew here at the Emergency Operations Center, and those who are providing an essential service, the grocery stores, pharmacies, takeout delivery establishments. Flagler County, we have your back. This is our calling, and we are endeavoring to do what is right and caring for you in a caring and compassionate way. We will get through this together with a healthy dose of determination, cooperation, and support for each other.
Will you reiterate again how many tests are available in Flagler County?
So we have about 5 to 6 testing sites right now in Flagler County. The health department, we're testing throughout the day. Advent Health Palm Coast Hospital, our 2 urgent care centers, and Azalea Health on the Parkway. I think they've changed their name. They're our federally qualified health center, but they're on the Parkway by Wendy's. They're doing testing, and I think a couple of doctors' offices are as well. But I would go to an urgent care center, to the federally qualified health center, Azalea Health, call the health department, because what they'll do is they'll screen you to see if you meet the testing criteria. Again, that includes the clinical symptoms and what I just mentioned in the presentation. So that is what you need to do. From what I understand today, all of these places do have enough testing collection kits to do the testing. So we appear to be in good shape here in Flagler County regarding resources all the way around. Jonathan has shared with us that supplies are trickling in on a weekly basis. And so we're very happy about that. And we know that the federal government, state government, along with the power of private industry, they're on it. They are working around the clock to make sure that supplies are manufactured and distributed throughout our country and to the most hard-hit areas. The hardest hit area, by the way, is South Florida, here in the state of Florida.
I don't see any more questions coming up on the screen. Jonathan, did you have any final thoughts?
Yeah, just in closing, for everybody to please continue to follow the CDC guidance and make sure you follow the governor's safer at home orders. So for those people who are working with essential services or conducting essential activities, again, don't use that list as a reason to do something. Just take the time and make sure that what you're doing is something that's absolutely necessary. And if you are conducting those activities, please make sure to follow social distancing guidelines. Thank you.
Thank you for joining us.